Monique, thank you so much for joining me. It's great to see you again. Now, Woebot, I think a lot of people know the name. I think of it as a pretty big thing, but
Yes.
take us back, talk through the journey and where you've been and where you're going to.
Yeah, no, it's so great to be here and great to see you as well in person. Woebot Health has been around 5 years and we're a digital therapeutics company. But you're right, what's behind there? Been in the press quite a bit actually. And I think we get quite a bit of spotlight because we're doing something that's really pioneering a particular space in the digital therapeutics, which is we're really focused on making, we're based on CBT, so CBT and other techniques that are used traditionally in talk therapy. But what we're doing differently is these elements of making it replicating things that happen in face-to-face therapy, which means developing a therapeutic alliance, being responsive to where someone's at, and then we're working on becoming more precise. So, people have different levels of symptoms. And it's all delivered through conversational AI that is trained on psychological principles. So that's called Woebot. So Woebot is the name of the actual robot. Woebot Health is the company.
Very good. And I've got it on my phone. I've had a play around. I have to say, when you use it, it does feel like you're speaking to a real person. It kind of you feel that same level of emotion. So I can see that differentiation. The CBT space, as you know, is incredibly busy. So do you see anybody else coming close to what you're doing, or do you still think you've got that real advantage there?
There are a couple of other companies who are getting, this space of conversational agents and chatbots. So it's a emerging space, evolving space. So we've seen other players come into having a dynamic, a conversational interface, but the level of rigor of really being able to ground it in real CBT and making it fidelitous to true, very best in class CBT. When we go very deep into what they're doing, we think that we're staying much more fidelitous to actual the clinical practice.
Yeah, so I guess like the best medicines, there's some really strong deep science sitting behind the
And
application.
actually, just like medicines, you can't look into the molecule. Same thing is that you at the clinical, when we're evaluated on the other side by clinicians, they can really see what's inside.
Very solid technology, very solid CBT, behavioral science behind it, but you still need to get that into the hands of people, and people need to then use it, stay with it. So tell me a bit about your go-to-market strategy.
Yeah, our commercial strategy, I mean, I think the field, the conference has been terrific, and you can hear how mature the market is starting to think of these things. So we see the commercial strategy as being quite broad. So digital therapeutics have multiple intended uses. I think that early on we all spoke about PDTs, prescription grade that were specifically for
Right.
treatment. But we know that there are other intended uses. So we have one track that's pursuing the treatment, just very classically like a PDT, but we're really closely looking and moving pretty fast into the behavioral health space as well for adults.
I guess the market, if you like, for this is massive because this is not just for people who are dealing perhaps with depression or those kind of mental symptoms, but every disease has an impact potentially mentally on people. Is that the way that you look at
No,
it?
absolutely. And in fact, you hit it, so you have to think of a diagnosis and then symptoms. So, and many people who have, the chronic diseases that really drive up the costs in care have symptoms. They may or may not be diagnosed. We think that there's a lot of comorbidity. And just think about it, if you're uh, not well physically and then you can't work through the behaviors, you're not making the right decisions, you're not taking care of yourself, and it's driving up the cost. So we think that we've seen quite a few indicators, sort of two related sectors. One would be in emerging virtual care because they need a behavioral piece, and then in coordination of care or in, provider and payer systems that are looking to try and bring those costs down. It's especially in the market we're going into, it's a really important pain point.
And you mentioned payers there, which can be a complex landscape, obviously varies by country. So where are the payers at the moment in terms of understanding this type of application and where it fits in?
I mean, from what we've seen, I think if you're, interestingly, although they're slower, at least in the US, on the adoption of the PDTs, and that standard is really high, because as a company we operate in that space, I think we get permission. We're bringing in that level of rigor and science, and so it really helps the conversation about how can you drive results, what's your rigor, what's your quality and compliance. And I think that they're really opening up in terms of wanting to solve. We had a few waves. We had telemedicine, didn't really work. Then we looked to scale coaching. We looked for these other modalities, and I think there's an understanding that you need technology to scale this.
And do you see any of that kind of history in those conversations? Because some of the payers, there's been a lot of noise, if you like, around digital health and digital therapeutics. Some are probably being burned, and that maybe makes it a little bit harder when you come along with something really sound. Does that reflect on your conversations?
No, I think this is the ebbs and flows of tech, and I think the people we are speaking to at the moment are, I think the level of maturity is just much higher. And I think no one goes in with this naivety that, oh, it's just going to be the product or I just need 1 year. I think we know it's going to take time. You need to have the right people. You need to make a concerted effort. You have to think long term. I think we know now just what it takes to make these things successful. And nothing will take away the pain point. The pain point is enormous. So it's not easy, but I think, I'm confident in sort of the inevitability of it.
And I'm going to mention a really dirty word, which is COVID. Sorry, we don't like to talk about COVID now, but COVID has accelerated quite a few digital health things. Have you seen an impact with your business?
I mean, I think, been an interesting topic here. There was one person who was saying, can we stop saying it was because of COVID and we're normalizing? I think probably, I think what I see lasting from COVID is this idea of if you focus and you really drive the team, you can do more faster. So I think that was one lasting takeaway. I think it did help people talk more openly about mental health. So the problem was there. That didn't change, and it did drive, it did accelerate mental health, but I think it made it more open to talk about this issue. Things like loneliness, things like how much we need to bond, and things like what are the drivers of mental health. I think that opened up that topic probably a bit more.
Yeah, that's a great point. I've certainly seen a lot more noise around mental health and, prominent figures coming out and speaking more openly. But as you say, it certainly impacted everybody, I think, during COVID and brought it more into people's consciousness. So I'm sure you've got lots of stuff going on. I'm sure much of it you can't talk about. Is there anything you can say about what to expect in the next year or two as to where you're going?
I think we've got a great team, and I think we're driving really hard into um, making sure that we deliver on the science and tech. So really important, we think, to be able to uh, think of producing products that have multiple intended uses. So I'm really excited about the progress we've made and the momentum we have there. And then on the business development side, it's setting up really good first phase ones of commercial partnerships and then showing results and keeping on growing. So probably we'll see some announcements there.
And I guess the last question, but for someone like you, I mean, you've got lots of experience in the industry. So what keeps you excited? What makes you really passionate about what you're doing with your work at Woebot Health?
I think it's the speed now that you can work because we know better. The teams, those early barriers to working cross-functionally are going away. My team works very efficiently. We understand each other's domains, and that's really exciting, is to bring the teamwork. I think the science is opening up. And even though there's been a lot of talk about the investor community being tough, I think investors are still really committed to the the companies that are going to figure it out. So I think those things keep me going.
Yeah, and I guess in a way, as the investors do get a bit tougher, it filters more funding to the stuff that actually works and makes a difference, which if you've got that, it's great.
Yes.
Monique, it's always good to catch up with you.
Nice to
Thank you
see you
so
again.
much.
Thank you.